Hi, I'm back. I wanted to check in with you guys about some sample questions that are conceptual questions similar to the kind that you may see on your final. So I picked a topic, which is the Fertility Awareness Method. This is an interesting thing to be aware of because even if you are a GERO NP student, it is something that we got from the first part of the course that could come back and is definitely a test of how you kind of reason through the questions. So I just wanted to use the format that we talked about, which is the chief complaint, and then the population, and then is there an algorithm, and then the differential diagnoses. So, and I'm here in my dining room, and my family's here, so sorry if it's a little loud, but there will be other noises going on. Just try to ignore them. Okay, so the question is, a postpartum prima gravida is using this fertility awareness method, and she's breastfeeding her 3-week-old infant. So what concern related to interrupted sleep may impact her ability to successfully use this method? So it seems like a very long, kind of complicated question, but the idea is that it's really trying to give you a vignette of a patient who would walk into your office and what you would see and how you would kind of move forward. So let's first break it down by the chief complaint. And the chief complaint, honestly, that I see here is that she is breastfeeding. And that's really important because if you look at the question itself and you identify the fact that she's postpartum as the chief complaint, then you may kind of mentally go a different direction. So instead of identifying postpartum as the chief complaint and focusing on breastfeeding as the chief complaint, it allows us to look at the next piece, which is the population. And the population here is a postpartum prima gravida, right? And that really is what makes the difference. Other relevant things that are here in this question, probably I would care that she has a 3-week-old infant. That's really important, and it wouldn't be there if it wasn't important, basically, because remember, these questions, even though they seem long, that's a little light, let's do it darker. Even though they seem long, the pieces of information that are in there are either really relevant or they're there to distract you. And in this case, it seems pretty relevant. So as you look through here, you can think about whatever it is that you know about women who are breastfeeding when they're postpartum and it's their first pregnancy, first baby, and they have a young infant. So even if you're not completely familiar with the fertility awareness method, you can think a little bit about what that population is going through and what things look like. So you get another really big hint here. And I actually took this example out of the readings, so it should be a little bit familiar to you. But the main piece of the question, now that we know what we're dealing with and who we're dealing with, is this little piece right here. What concern related to interrupted sleep? So this is the meat of the question. What is it about interrupted sleep that might impact her using this fertility awareness method? And so this is one of the times that knowing a certain amount and being able to kind of logic through what you do know will definitely compensate for the fact that there really isn't a chance that you're going to know everything about this method because there's just too much to study. So when you have a 3-week-old infant, we know that they have to, if they're breastfeeding, you're basically feeding them on demand, but you are feeding them frequently because initially when they're born, they do have a tendency to drop weight a little bit, and then they kind of have an upswing in weight. And you know that she's a first-time mom, so she may have concerns, she may have a lot of support, she may have very little support, but this is kind of that first interim piece where you're just getting used to the breastfeeding, right? So what we know is that interrupted sleep is not abnormal. It's actually probably the most likely situation for a woman in this question, right? So interrupted sleep, normal. So it's nothing that we have to change. And sometimes it helps to think like normal, abnormal. And so in this case, what the question is telling you is that there is a reason why this normal behavior is going to impact this method. So this is where we start kind of thinking back through the patho and kind of the early part of the class. So we do know that the way that you use this method is that you really have this awareness of your body. It's built right into the question itself. And so you're tracking like the viscosity of your cervical mucus, right? Your and vaginal mucus actually, and you're also tracking your basal body temperature. So now I'm kind of thinking, what do I know about tracking these things? The mucus, I don't remember there being any specific rules about the mucus, other than probably you're not looking at it post-coitus. You're probably looking at it kind of an uninterrupted mucus measurement. But as far as basal body temperature goes, what I do remember is that, and actually Dr. Hamilton made a big deal about this in class, you can't just get up out of bed and then measure your body temperature because it's going to change, right? So you need 6 hours of uninterrupted sleep to actually get an accurate measure. And you can't sit up and drink some coffee, and you can't get up and go turn off your alarm and come lay down again. You basically have to, as calmly as possible, sit up in bed, take your body temperature, and use that to track it. So now this is where the logical piece comes in. How likely is it that this primigravida is taking the time, has 6 hours of interrupted sleep? That's just not even realistic, poor thing. But even before that, if she's prompted to get up and breastfeed because the baby is crying, or because the baby's aroused and she heard it on the monitor, or because she's engorged, which means it's probably coinciding with when the baby's hungry, the odds that she's going to be able to accurately measure this body temperature is pretty low. And so as a nurse, if I got this question and I'm thinking about issues that may impact her ability to successfully use this, this method is something I would really want to talk to her about and say, look, it's not really going to be accurate unless you are able to get the 6 hours of interrupted sleep. And maybe you can. Maybe you work with your partner and you store breast milk and sometimes they trade off with you. But if you're not going to do that, how realistic is that you're going to follow this? And you really don't want stacked twins. You really do want to give your body some time to recover before you get pregnant again. So if fertility is an issue to her and she doesn't want to immediately get pregnant again, this is definitely something that you would put into your answer. Now, how you word this in a narrative answer, it can be very short and sweet. And it can literally be, for this primigravida, it's unlikely that she's going to get an uninterrupted 6 hours of sleep, which will affect her the measurement of her basal, of her basal body temperature. And because of that, it's a discussion we need to have. Or it could be something very simply like, because it's unlikely that 6 hours sleep is occurring at this time, I could discuss with her ways that she could continue to breastfeed successfully, but still be able to make sure that she's appropriately using the method. So you can answer it however you want to. But the key concept here is we want to address why it might be an issue, and then how you would proceed from there. So I hope that example was helpful. I'll throw together a few more examples. And what we're going to do in the very last video is that we're going to talk about how you translate these sorts of conceptual narrative answers into multiple choice questions that are conceptual, which is kind of a little tricky. Anyway, okay, thanks.